Hi there. Welcome to Snackable Health with doctors Gibson and Kohli. And today we're talking about the contrast dye shortage that's been experienced nationwide. So, Mike, you're an interventional cardiologist. Tell me a little bit about how this is impacting your care for patients.
Well, just like politics, it's all local. Some states and centers and hospitals are doing okay. Others are really facing a shortage, and it depends who your supplier is. The supplier that's really been most affected is that coming from GE Healthcare, which has its manufacturing in Shanghai. And due to the exposure to COVID in Shanghai, where they've shut things down, the plants are shut down, and the dye is not coming to us from China anymore. So, in some sites, in some cities, they're really kind of rationing things, and you can only get a CT scan, say, if you have an acute illness. So, it's a little bothersome, say, for people who need that cancer screening and things like that. In some places, if you have stable angina, not having a heart attack, you can't get your angiogram. Now, there is progress being made. There's other dye manufacturers, and they are kind of stepping into the situation. And I know we have negotiated to get some from another contrast supplier. So we're doing okay. We should be beyond this in weeks to a month or two. But it really emphasizes that we've got to broaden our supply chain for some of these critical medical diagnostics.
So incredibly scary because contrast dye is something we need in cancer and heart disease and lung disease and so many different conditions. So certainly as a physician, it's concerning, but also to me as a patient. But it sounds like, what the pandemic has highlighted is all the supply chain problems, whether it's baby formula or contrast dye, that we really need to focus on. So thank you, Mike, for that update. And here with Snackable Health, doctors Kohli and Gibson signing off.